And this is disorders associated with the immune system, Chapter 9 in Tortura. Okay, so normally your immune system is supposed to be protecting you against foreign invaders, pathogens, and most of the time it works fantastic. There are other times when it actually turns on you and either attacks self or attacks some very non-invasive entity and sets up what are called hypersensitivity reactions. So these are adverse or inappropriate immune responses that can happen in some people. So the disorders associated with the immune system, infections, and immunosuppression are failures of the immune system. So HIV is an acquired immunodeficiency. It basically is an immunosuppression of the immune system. Immune reactivity to self-antigens is also a failure of the immune system. So that would be something like type 1 diabetes, where the immune system turns on itself and destroys the cells that produce insulin. And last but not least, allergies and autoimmune diseases are harmful immune reactions called hypersensitivity reactions. And that's really what we're going to be talking about in this particular chapter. Okay, so we know about antigens. Antigens are those molecules on the surface of a cell that can be seen as foreign or different by the immune system. And then the immune system is going to evaluate the response. So now when it says require sensitizing doses, when you are first exposed to something, let's say that you later on become allergic to, the first exposure, there's no symptoms. And it's called sensitization. The person is sensitized to the allergen or whatever it may be. And that means, and the reason why they don't have reactions, is timing. So it takes days for the T helper to be activated, to make cytokines, to recruit B cells, to make antibodies and killer cells, etc. So that delay, and even a vaccine, you're not really sure that it's kicked in for about 6 weeks. So by the time all of that is established and memory is established, then usually the molecule or cell that is seen as foreign or different is long gone. So that sensitization, however, has happened, and the person doesn't know it because the person has no adverse reaction to it. It's the second time. After memory is established, it's going to be the second exposure that will be the reaction. Okay, so there are 4 types of hypersensitivity reactions. Type 1, anaphylaxis. Type 2, cytotoxic. Type 3, immune complex. And type 4, cell-mediated, also called delayed. All right, type 1. Type 1 is named after the most pronounced response to an allergen, which is anaphylactic shock, which, if not reversed quickly, can cause death. So people who are incredibly allergic, let's say to peanuts, then they usually carry an EpiPen with them because epinephrine would be able to bring them back from the brink of death because it will automatically reverse the reactions, the hypersensitivity type 1 reactions that can occur after a person has been sensitized to peanuts. The culprit is twofold. The first culprit is IgE. This is an antibody of allergy. Most people who are not allergic don't make IgE, they make IgG, and IgG cannot cause histamine release. Only IgE, and it stands for epsilon, and IgE can cause this. Why? Because it is the only antibody that has receptors on these mast cells. If they're in the blood, they're called basophils, and all of these wonderful red and pink dots represent vacuoles within the cell that are chock full of a very active compound called histamine. Now, the histamine and a secondary one is leukotrienes. They are all about causing an inflammatory response. They are usually sequestered in the mast cell where you're not going to have a reaction because they're inside. If, however, you are allergic to peanuts, then you get sensitized, you have a memory response, and then the second time you're exposed, let's say this is a peanut allergen right here, and then that allergen or antigen binds to the IgE, which is bound to mast cells, and they are scattered throughout the body. There isn't any place in the body that doesn't have a smattering of mast cells, and that's going to be the trigger for histamine release. And so it says involves IgE antibodies. It is localized, meaning that some allergens, some antigenic molecules are going to be systemic, meaning that all of the mast cells in the body will release histamine at the same time. That's the most deadly form. That's anaphylactic shock. Sometimes it's just respiratory. So somebody inhales an allergen and they just have a respiratory response. Some people are allergic to food. So they eat the food and they vomit, diarrhea. And it just means that those mast cells that release histamine are just in the abdomen. If you have an allergy that expresses as hives, it could be something that you put on your skin. It could be clothing. Many people are allergic to wool. And that means that the mast cells beneath the skin are going to release histamine, and that this causes the hives. So it really depends on whether it becomes localized or systemic. So localized hives or asthma from contact or inhaled allergens, systemic shock from ingested or injected antigens. And I'm going to use peanut allergies because it's almost epidemic. It's just something that never was in my time, and it's so common in my daughter's time. So, and I have heard of horror stories around peanut allergies causing anaphylactic shock and life and death stories around EpiPens. So that is type 1 anaphylaxis. So here we go, the peanut allergy. So the child first has to be sensitized. They have to be exposed. Everything seems to be fine. Not really, because behind the scenes, the antibody that is chosen by the body is inappropriate. It's inappropriate to produce IgE to peanuts because peanuts are not trying to take over your body. Peanuts are not pathogens. They're not trying to gain a foothold and cause disease in your body. They're peanuts. But for whatever the reason, and we really do not have a good handle on this, nor can we reverse it as of yet, but for a child that is going to react in this way, peanuts can be extremely problematic. So once they're sensitized and they have memory, they get re-exposed to peanuts, and then IgE, memory, can bind to receptors on mast cells and basophils, right? These phagocytic cells that are filled, I'm sorry, they're not phagocytic cells, they're mast cells and basophils that are filled with histamine. Okay, so then you get the sensitization step, you get the memory, and then you get the atopic reaction. So let's talk a little bit about histamine. It's an amazingly powerful molecule. It has 3 major outcomes in the region where it's released. So it's going to be released by mast cells or basophils, in this particular case, through IgE binding to the mast cells and basophils, and then the histamine that's released diffuses into the area. So histamine can cause an increase in permeability of capillaries. Now that is because you want to attract immune cells that would remove the offending allergen or antigen. The unfortunate thing is, in addition to releasing phagocytic cells, you are also releasing a lot of plasma. So the plasma is going to cause swelling in the tissue area, called edema. The thing that you also have that can happen is the increased pressure because of the increased fluid retention in the tissues can trigger pain reactions. The second thing about histamine is an increase in vasodilation. So you're going to have the dilation of the beds to the wound area or to the infected area or to the area where the peanuts are, and that is going to increase the flow of blood cells to that area, and that should deliver more phagocytes quickly. But then again, peanuts are not trying to take over your body, and a kind of a downside of that is that whole area becomes quite hot and quite red. And then last but not least, smooth muscle contraction. And that is going to cause a barrier. And very often tissues, organ systems have smooth muscle as either like the next to last layer. So when that becomes contracted, it becomes difficult for a pathogen to spread from one organ to another. But this is a peanut, right? So if you have histamine, for example, released in your respiratory system, what is going to contract are your bronchi and bronchioles. And they are arranged in circles. So when you get smooth muscle contraction, the air passages get incredibly narrow, and the person is struggling to take in a breath. Now, it says, depending on where in the body the mast cell releases histamine, it can cause breathing or respiratory problems, hives on the skin, gastrointestinal, diarrhea, vomiting, and sometimes the histamine release is systemic, which can lead to life-threatening anaphylaxis. Just envision this. You have suddenly all of the mast cells in your body be triggered by peanut ingestion to release the histamine at the same time. So that means that you're having a huge amount of fluid move from the cardiovascular system into the tissues. That is going to cause life-threatening shock. The person is going to have their blood volume and their blood pressure just plummet, and never mind complications around bronchoconstriction, etc., etc. And that's the reason why anaphylactic shock can be deadly so quickly. That's the reason for the EpiPen, because epinephrine, also called adrenaline, can counter this. In other words, it can immediately, within seconds, vasoconstrict, decrease permeability of the capillaries, and increase smooth muscle relaxation. And then that person survives. If it's not life-threatening, like hives, then taking antihistamines by mouth will take about a half an hour, but that can give you relief. But if you have a systemic anaphylactic reaction, then you've got to have that EpiPen. Okay, so this is just showing you how they test if you have allergies. They can also do this by blood. They don't have to do it by skin anymore, but a little bit of the allergen is scraped into the person, and if they then have a wheel and flare reaction after it has been there for a bit, then that person is allergic to that substance. So it says skin testing can determine what the allergy-causing chemicals are. They can do it this way. They very often, especially if it's a dangerous situation, will take a sample of blood and do it so the person doesn't have to sit in the doctor's office and perhaps go into anaphylactic shock. Can you get treatment? Yes. Desensitization is also kind of interesting in that they give the person a very small dose of the allergens that they are allergic to over a long period of time. It might take several years, but if the person then can, or if the person is going to be successfully treated by this type of therapy, you'll see a transition from IgE, the antibody of allergen, to IgG, which is not going to be able to bind mast cells and cause histamine release. And the person, when they make that transition, is now no longer allergic to that substance. Okay, so type 2. Type 2 reactions nowadays are fairly rare. There used to be a problem with mismatched blood transfusions, but blood bank is so accurate at this stage of the game. So I'm going to choose a different example. Again, rare, but it absolutely can and does happen. Cytotoxic, meaning you're going to kill cells. And it's type 2 because you're dealing with IgG, not IgE. So it's the IgG antibody, and it goes hand in glove with a substance that is in everybody's serum in an inactive form called complement. And complement, when it becomes activated, is amazingly fast at destroying the cells to which the IgG is bound. And it will then cause cell lysis, and I'm going to talk about drug-induced hemolytic anemia. Right, it's rare, but can rapidly lead to death in the person if not caught in time. This is actually based on an individual that I knew, and the way that they were able to save his life is they actually did, in the emergency room, a whole body blood transfusion. So let's kind of explain what happened. He had a series of strep throats and took penicillin, and everything seemed to be fine, but at some point there was that sensitization, and of course nobody knew about it. Now, what was the sensitization and what happened to him that doesn't happen to the rest of us? What happened to him is that the penicillins at some point started to bind to his red blood cells. Now, that should never happen. Penicillin should end up absorbing into pathogenic bacteria, especially gram-positive, and they interfere with cell wall. And it's very, very effective against a gram-positive pathogen like strep. What happened to him was rare, but it can happen. And I think the problem is that unless it runs in the family, you're not going to know about something this rare until the person actually is in a bad way, let's put it that way. So the penicillin very inappropriately was binding to the red blood cells. Again, they could not figure out why all of a sudden the penicillin would do something so aberrant, but it did. And now this individual can never take any penicillin or penicillin-based antibiotics for the rest of his life. So the penicillin was binding pathologically to red blood cells. Now, again, that's going, that IgG, that sensitization won't produce symptoms because by the time weeks went by, memory was established, the penicillin had long gone. But strep throat came back again, and unknowingly, he took penicillin and went into shock very quickly, and his wife was able to get him to the emergency room. And what was happening was a classical type 2 cytotoxic hypersensitivity reaction. The dose of the penicillin was enough to have the penicillin bind to the red blood cells. Due to the memory response, IgG latched on, and with complement, simultaneously, he probably had the equivalent of having 3 units of blood just lysed, all those red blood cells just lysed simultaneously. So his ability to pick up oxygen, to release oxygen, and the most fragile of all the organisms, or all the organs in an organism, is the brain. So that if he had not presented so quickly, then he would have gone into shock and died, and just would have slipped into a coma, and that would have been it. He was lucky enough to present to an ER that understood what was happening, and then that's when they did the whole blood transfusion. Because then the transfused blood was the right blood type, but it was from a person who didn't have red blood cells that would bind penicillin. So that's how they saved his life. And it's not just penicillin, but I use that because any drug that you take should not do something as aberrant as bind to your red blood cells and sensitize them so that complement can en masse kill them, but it can't happen. And it's type 2 cytotoxic hypersensitivity reaction. All right, so this is just going a little bit more about the B lymphocytes, the memory antibodies that are anti-penicillin antibodies, and we expose IgG bound to the red blood cells carrying the penicillin, and with complement, you had simultaneous lysing of red blood cells, bringing him to the brink of death. All right, type 3, immune complex hypersensitivity. Many autoimmune diseases are type 3. Not all, but many. And if you have an autoimmune disease, again, inappropriate, your immune system should never see any part of you as non-self. It should always and forever remember you as self and pathogens as non-self. And I am going to use as an example lupus. So it says sometimes the immune system can be re-regulated. Again, we don't know all of the pathways and we don't know how to reverse them yet. But it can be re-regulated to perceive self as non-self. An example of this is a disease called lupus, or systemic lupus erythematosus. Fragments of DNA in the blood, that's normal. Your body should never see DNA as abnormal. It should never see DNA as foreign or different. But you do have body cells that are going to die normally during the day, and the fragments of the cell, including fragments of DNA, should just be filtered by the kidney and just peed out of the body. And that's what happens to the rest of us for individuals. And it tends to affect young women more than any other population. Then the DNA, after sensitization, is seen as foreign or different. And then the person's body's immune system will make IgG autoantibodies against DNA, which is very abnormal. Now, DNA is not a cell. And you're going to say, really? I know it's not a cell. But what I'm trying to explain is that you're not binding the IgG to a cell. You're binding IgG to a fragment of DNA. So a fragment of DNA is thousands of times smaller than a cell. So the antibody, which is also quite small, and the DNA will start to form a crystal. And this crystal-like complex is called an immune complex because it's made up of, antibodies, which are part of your immune system, and it's making a complex with something small like DNA, a fragment of something. So what is going to happen is that these anti-DNA antibodies will form a complex with the DNA fragments in the blood. Now you've got a problem because these crystalline-like fragments get caught in very small capillaries. The most fragile, the most sophisticated capillaries in the body, they're in the kidney. So when you have these immune complexes, when a person is suffering from an acute episode with lupus, these immune complexes get caught in the capillaries and they're going to start an inflammatory reaction. And this is many places where inflammation is a good thing. In the kidney, not so much. It's a very bad thing, because then you start to get the cells around the capillaries that are pumping out all of these inflammatory cytokines like histamine, and it ends up injuring permanently, because kidneys cannot regenerate tissue. So if a person has an acute episode, they will then hit that individual with anti-inflammatories to kind of knock down the immune response. But then at the end, that kidney has received a certain amount of kidney failure. There's a certain percent of kidney failure after that, and you never get it back. It just keeps progressing, and until the person is in end-stage renal disease. So that's the reason why immune complex type 3 hypersensitivity can be quite harmful, especially over a period of time. All right, so this is just giving you a little bit more detail. The IgG antibodies and the DNA antigen can form complexes, immune complexes, they tend to lodge in the basement membrane of capillaries, and the organ that is usually most affected by this type of reaction is the kidney. So the inflammation damages the kidney and can lead to kidney failure. And by the by, basement membrane is it's a covering around the capillary, because they're so thin, they're so fragile. It's like a protective covering, but then there's a wee bit of a space between the basement membrane and the endothelial cell of the capillary, and that's when you start to get these complexes lodged, and then inflammation is not your friend. Okay, so this is just showing you the immune complexes, because at times I feel like I'm not really explaining it very well. This could be a piece of DNA, another piece of DNA, another piece of DNA. This is an IgG, and this is showing you, this is the basement membrane, and these are endothelial cells of the capillary, and this is trying to show you the complexes, and then you have inflammation as it tries to clear it, and then that inflammatory response, though, damages the capillaries, it damages the glomerulus, it damages Bowman's capsule, the nephron, and that is permanent. All right, last one, type 4, cell-mediated or delayed. This is a hypersensitivity reaction that has no antibody at all associated with it. So that's going to therefore be associated with T lymphocytes. That's why it's called cell. There's no antibodies, it's just the T lymphocyte reaction. Delayed because when you are exposed to something that is going to cause a type 4 hypersensitivity reaction, it won't be immediate like a peanut. It will be 2 or 3 days down the line you get the reaction. And you won't feel sick, or you won't have the rash, or you won't have the organ rejection until days later. So let me go into this a little bit. So this hypersensitivity reaction only involves T lymphocytes, no B cells, no antibody. Examples of this can be seen. Now, there are going to be 3 of them. Poison ivy skin rash, that's the one I'm going to go into more detail, because those are the ones that will be more prevalent. Another one, though, that is, I'm sure that everybody had to be tested to see if they had active case of, or even inactive case of tuberculosis. In other words, were you exposed? Do you blah, blah, blah. And so it's a very simple skin test. It's called the Mantoux test, or the Mantoux reaction. So this TB skin test is such that you're told to actually wait 2 to 3 days before you examine it. It takes that long for type 4 hypersensitivity reaction to express itself, and that's the reason why you don't read the Mantoux test until days later. And organ rejection reactions, we now realize, very much are mediated by type 4 hypersensitivity reaction. we are much better at managing it, but that is always going to be an issue in the back of a person's mind, that they have received an organ from someone close match, not an exact match, and what everybody is always worried about is, will the person eventually reject the organ? Understand that from the viewpoint of the immune system, it's doing something quite correct. Unless you have an identical twin, the match is close but not perfect. So mounting a type 4 is not really inappropriate. However, I will get into poison ivy skin rash because mounting a reaction to a plant. No, the plant isn't even ingested. You come in contact with the plant, you get some of the poison ivy, they're called catechol oils, as an OIL. And the reason why I emphasize the oil is that it's really easy for some oil-based chemicals to seep past that dead layer of epithelium to the living cells and then bind to it, and then you're off and away. So I do believe, yes, here we go. So a poison ivy rash, person again has to be sensitized. And then upon re-exposure to poison ivy, which is just so prevalent in this neck of the woods, a harmful T lymphocyte response is initiated. No antibodies are involved. It takes days to elicit a T lymphocyte response. Hence, cell-mediated is the T lymphocyte, and the delayed is the fact that it's days. Okay, the oils from the poison ivy plant seep into the skin and bind to epidermal cells, making them foreign or non-self. Very inappropriate. I'm sorry, poison ivy plant is not trying to get into your body, it's not trying to take over your body, whatever. And there are some people who are just not allergic to poison ivy. Again, if you are a person who might have taken a hike and been exposed to poison ivy on a Sunday, you're not going to see the rash until Wednesday. Having said that, it's inappropriate to have a reaction against poison ivy, but it happens to a lot of people. So again, poorly understood, the response is only by T lymphocytes. Activated T lymphocytes, like T cytotoxic cells and their inflammatory cytokines, can arrive at the site of the cells, right, where you've come in contact with poison ivy, and the poison ivy oils have now sunken into the layer of the epidermis where you have live cells. That makes them foreign or different, and now the T cytotoxic cells and the cytokines start to attack them and do inflammation, and the person has a poison ivy rash. So we have activated lymphocytes like T cytotoxic cells, cytokines arrive at the site where the cells are bound to poison ivy antigen and commence an inflammatory response causing the rash. That person is going to be allergic to poison ivy for the rest of their life, and they will elicit a type 4 hypersensitivity. Poison ivy is one of the few exceptions to when people say you're allergic to. Well, if you're allergic to poison ivy, you do a type 4 hypersensitivity reaction. If you're allergic to peanuts, you do a type 1. Most allergies are type 1. Good exception is poison ivy allergy, that's type 4. And there we go. Lovely example of what a poison ivy rash looks like. Okay, so we have a delayed type of hypersensitivity due to T cytotoxic and the inflammatory cytokines. Here's a poison ivy rash for you. And then the T cytotoxic cells and their signal molecule cytokines initiate inflammation, which can cause tissue damage. So this is a summary slide, and we're almost done. So we have 4 types of inappropriate harmful immune reactions. Type 1 anaphylaxis due to IgE, inducing histamine. Type 2 cytotoxic, where IgG react with cells that have antigens on them, and along with complement destroy the cells. Type 3 immune complex, where you have IgG antibody, but it's a small fragment of something. So you have the immune complexes formed with, let's say, DNA, like in lupus. And then the complexes can deposit in organ capillaries, causing inflammation and damage. And then type 4, cell-mediated/delayed, mediated only by T cells, like T cell toxic cells and their inflammatory cytokines, which can cause cell, tissue, organ damage, depending. And that's it. So I will see you next time for antibiotics.